My story began about 13 years ago when I found out I was a carrier for the BRCA gene. My mother, who had breast cancer at the age of 52, was actually advised by my doctor, even after she finished all her treatment, to get tested for the BRCA gene. She tested positive for BRCA2, and so did my aunt. All of my siblings and cousins needed to then get tested. Only my brother and I tested positive for the BRCA2 gene. Because of my test results, I immediately scheduled my first mammogram at age 32. My mammogram did not detect anything suspicious. However, the doctor mentioned that I should also do an ultrasound because that's how my mother's breast cancer was found. He performed a thorough ultrasound in order to establish a baseline image. He scanned my whole chest and neck area and even under my arms. It so happens that at my first ultrasound, he saw something suspicious on my neck. He performed a biopsy and I tested positive for thyroid cancer. I went through a series of emotions from anger and frustration to anxiety. Not only did I test positive for the BRCA gene and have to worry about the high chance of getting breast cancer, I now had thyroid cancer. My mother said that the BRCA diagnosis was meant to be and it saved my life. If I didn't go for an ultrasound at 32, I would not have gone for my first breast cancer screening until at least the age of 40, and my thyroid cancer may have been too advanced. I did not have the time to deal with my emotions since I had to schedule surgery immediately to remove the tumor. After my recovery, my breast cancer screening became a series of appointments, which ranged from 5 tests every 6 months, a mammogram, an ultrasound, blood work, a routine physical exam, and an MRI. I slowly built a medical history file where I was carefully monitored for any changes to my breast tissue. I became accustomed to this whole process. First, I was angry that I was the only young woman in my family that was BRCA positive, but then I realized because of this knowledge, I had the power to be in control of my health. At this point, I did not reach out to anybody. I was very reserved about my situation and really just leaned on my family for support. I knew there were other people out there that may be going through what I was going through, but I was so caught up in the day-to-day of working and running a household. It was lonely and isolating at times, but I had my routine. About 9 years ago, at the age of 36, I made the decision to remove my ovaries once I decided that I was finished with having children. This minor, simple surgery was strongly encouraged to eliminate the risk of cancer, and so I performed the surgery in 2013. I'm fast forwarding the story to about 4 years later, when I was approaching the age of 40, and the doctors recommended a prophylactic double mastectomy to greatly decrease my chance of being diagnosed with breast cancer. The doctors suggest having the surgery about 10 years before the age of the first breast cancer diagnosis in the family. I was making my son's bar mitzvah that same year, and I could not give this decision the full attention that it needed. I pushed it off for another year, and it all came to a head the week my son's bar mitzvah was over. The breast imaging radiologist, who I've been seeing for the past 9 years, and the one who caught my thyroid cancer, decided to retire. I took this as a sign that it was the right time to do the surgery. Although I had gone through 2 surgeries since my diagnosis between my thyroid and my ovaries, this decision seemed somehow more daunting, but it also seemed like the final step of surgeries to become part of the 95% of people who have a reduced risk of breast cancer. While this surgery came with its own set of emotions and complications, I want to focus on the 4 years prior to making this decision. Another factor came into my life after my ovaries were removed. I was highly likely to get osteoporosis based on my family history and my thin frame. Immediately after my ovaries were removed, I did. I was a 36-year-old postmenopausal woman with osteopenia bordering on osteoporosis. Because of the breast cancer history in my family, I couldn't go on hormone therapy, and I had to figure out a plan to manage it. I was overwhelmed and began to go through all the emotions that I went through years before when I was first diagnosed with the BRCA gene. I was angry and frustrated and upset that I had to make another set of decisions about my health. Although this time I wasn't surprised by my diagnosis, I was warned because both my mother and grandmother also have osteoporosis. Both broke their hips at a young age. I knew the only way I could live with it was to look at the changes in my routine as something positive and not something to be fearful about. I followed all the recommendations of taking calcium and vitamin D supplements. I increased my diet rich in calcium, like almonds, broccoli, and yogurt smoothies. I avoided salty foods. I even added collagen to my coffee in the morning. And I try to have salmon at least once a week. I enjoy having fruits loaded with vitamin C, which have been proven to increase bone density. I love having apples, strawberries, and bananas. While working full time presents its challenge with finding the time to do weight bearing exercise, I'm lucky to work from home. So I always try to find 15 to 30 minutes of exercise like Pilates, walking outside, running outside, some type of dance class that involves jumping. Even doing 25 to 30 jumping jacks before I make dinner or before I get into the shower is effective. I guess I should consider myself lucky that I run up and down my stairs multiple times a day, cleaning up after my children, as climbing stairs is also a highly recommended exercise for osteoporosis. My doctor actually said that swimming and biking are not beneficial from an osteoporosis standpoint, but I shouldn't rule them out as enjoyable activities for my overall health. At this point, I had an orthopedic endocrinologist following my care, managing my thyroid and bone issues. I go for annual bone density tests and blood work to monitor any fluctuations of my osteopenia. Although I follow all the recommendations, my doctor still wanted to put me on medication because of my young age and because diet and exercise alone was still not enough to slow my bone loss. I went on Fosamax and was carefully monitored because patients generally do not stay on this medication for a long period of time due to its side effects. I was on again and off again every 6 months for about 3 years. There are studies that suggest that Fosamax continues to protect bones up to a decade after use. I, of course, suffered from the side effects that only a minor amount of people suffer from, severe joint pain. I then had to add ibuprofen to my routine to manage the pain. After a few years of this regimen, I broke down to my doctor and said, I may look great on the outside with my diet and exercise, but I don't feel great on the inside. There has to be another way. I kept saying I'm a 65-year-old trapped in a 40-year-old body. She recommended a once a year IV infusion called Reclass. Of course, I experienced the flu-like symptoms that last only about a week, but it was worth the trade-off. I felt like myself again. And although my joint pain is still present, it is greatly reduced and it doesn't interrupt my daily life anymore. While I understood the need to be aggressive initially with my bone age for the first 5 years, the changes I've made have been positive overall. And yes, it is true. When I walk or run outside, I have to be careful to go on a day when there's no leaves in the way or when the ground is not wet, because I have to eliminate factors that add to the risk of falling due to the increased risk of fractures that come with osteoporosis. I will never forget one summer vacation with my family in Maryland. I lost control of the Segway I was on and went into the boardwalk bench, and I fell really hard on my hip, hand, and knee. I immediately got up, and although I was in pain, I needed nothing more than an ice pack for this incident. I was lucky that I didn't even sprain anything. I told my doctor, and she said, "See, you are stronger than you think." My message to everyone here is that the guidelines of nutrition, supplements, and medication are life-changing, and they could be positive and beneficial to your overall health. It is not something I even have to think about anymore on a daily basis. It is something I just do automatically. I am now in a place both emotionally and physically where osteoporosis does not dictate my life. It's just part of my life. While COVID did disrupt my yearly infusion schedule, I'm back on track with my doctor managing my care while I manage the day-to-day. I choose not to focus on the fact that this is my genetic fate, but that the health circumstances I face give me the knowledge and power to be in control. I choose to speak about my story through Sharsheret, and hopefully I could be there to help any of you today.